There is no cure for the common cold, but certain medicines can help you feel better if you catch one. As we enter the cold and flu season, it's a good idea to keep specific items in your medicine cabinet. It's best to focus on prevention through a healthy lifestyle, maintaining a balanced diet, regular exercise, managing stress, and getting enough sleep. However, catching a cold is inevitable. When you do catch a cold, over-the-counter cold medicines can provide relief, but choosing the right ones can be challenging. However, the variety of cold medications available can be overwhelming. Not all cold medicines are effective. For instance, the FDA revealed that phenylephrine found in certain decongestants like Sudafed PE and Dayquil does not work when taken orally. Codeine-containing cough syrups are also not recommended. While there are some helpful cold medicines, their effectiveness can vary from person to person. According to pharmacist Robert Green from Johns Hopkins, there are a few gold standard options, but it depends on the specific symptoms you are trying to treat. What are the different types of cold medicines? The choice of cold medicine depends on how you are feeling, and you won't necessarily need several medications if you only have a cough. For example, here are the common cold medicines that doctors typically suggest for different symptoms. For treating fever, the go-to options are usually acetaminophen and ibuprofen. Acetaminophen is commonly known by the brand name Tylenol, while ibuprofen is found in products like Advil and Motrin. It's crucial to consult your primary care provider before deciding which medication to take, whether it's for a common cold or any other health concern. Ibuprofen may not be suitable for individuals with heart or kidney disease. Additionally, some healthcare providers advise against ibuprofen for elderly patients, as they may have existing health issues that the medication could worsen, while acetaminophen helps lower body temperature by eliminating excess heat. It does not address inflammation. On the other hand, ibuprofen falls under a category of medications known as non-steroidal anti-inflammatory drugs, or NSAIDs, which can effectively reduce swelling. Acetaminophen and ibuprofen are commonly used to alleviate headaches and sore throats associated with a cold, as they can help ease pain. Ibuprofen works by decreasing the production of lipids called prostaglandins, which play a role in pain perception. On the other hand, acetaminophen raises your pain threshold. To further soothe a sore throat, you can use a chloraseptic spray. Decongestants without phenylephrine can be useful for those dealing with a stuffy nose. For example, regular Sudafed, not Sudafed PE, can help relieve congestion. The key ingredient to look for in decongestants is pseudoephedrine, which works by narrowing blood vessels in the nasal passages. However, if you are in need of a decongestant, pills aren't your only option. Nasal saline spray or a device called neti pot can also be effective. The neti pot is used to rinse out mucus from the nose. One important note with the neti pot is to use distilled water, or water that has been boiled and cooled, rather than tap water. If you are dealing with a runny nose that won't quit, and it's not because of congestion, you might want to consider using an antihistamine. Some commonly used antihistamines include Claritin, which contains loratadine, Allegra, which contains fexofenadine, and Zyrtec, which contains cetirizine. These antihistamines function by preventing histamines, which are released by the immune system and can lead to allergy symptoms from causing trouble. There are various products available to treat a cough, such as tablets, liquid-filled capsules, or a liquid solution. However, the key ingredient you should look for in these products is dextromethorphan. Dextromethorphan works by targeting the part of the brain responsible for causing coughing. Some healthcare providers advise against using cough syrups or other products that do not contain dextromethorphan for treating a cough. In some cases, medications that combine dextromethorphan with guaifenesin. Guaifenesin is an expectorant, which means it helps thin mucus, making it easier to cough up. Common brand names for medications with both dextromethorphan and guaifenesin include Robitussin and Mucinex DM. Despite it seeming contradictory to use a medication that both facilitates coughing up mucus and suppresses a cough, these combinations can be beneficial for individuals who are experiencing excessive coughing leading to other symptoms, such as headache. In such cases, the thinning effect of guaifenesin is still needed, but the dextromethorphan provides relief if the cough becomes uncontrollable. What should you know about the placebo effect of cold medicines? It's important to understand that sometimes when people take medicine for common cold symptoms, they might feel better even if the medicine does not actually have active ingredients. This is known as the placebo effect. It happens when someone believes a medicine will help them, and their perception of improvement leads to actual feelings of relief. Research indicates that individuals who were given fake pills, the placebo, for the common cold thought their sickness was shorter and less severe compared to those who did not receive any fake pills. There is a suggestion that some individuals may have taken a medication called phenylephrine, even though it did not have any real effectiveness, because they believed it would help due to the placebo effect. A study from 2016 found that phenylephrine was not any more effective than a placebo in treating people. What are the other ways to treat the common cold? When dealing with cold symptoms, people often overlook non-drug treatments. If you are feeling congested, use a humidifier, or if you don't have one, sit in a steamy bathroom from a hot shower, which has a similar effect. Additionally, research indicates that consuming honey can lessen the severity of common cold symptoms. Ultimately, one of the most effective things to do when you have a cold is to rest. It's important to take time off, get enough sleep, and allow your body to heal. People tend to underestimate the value of rest, thinking they can power through, but lack of sleep often leads to worsening symptoms. So, taking a couple of days to rest can significantly benefit your immune system. There is no cure for the common cold, but some over-the-counter medications can relieve symptoms such as cough, congestion, headache, and fever. Specific over-the-counter painkillers can treat fever and headache, while certain decongestants can help if you are congested. However, not all cold medicines are effective. If you get sick with the common cold, ask a healthcare provider or a pharmacist which types of medications may provide symptom relief. Thank you for watching. Please like, comment, and subscribe. Watch more videos by clicking on the video here.